What are the main categories of birth control that are available today? How do effectiveness and convenience differ between those options? I'm Dr. Katie Nixon here at Norman Regional, and I'm here to discuss those topics with you. One of the most practical ways to categorize birth control options is by how long they work. A woman who is interested in trying to conceive in the next 6 months is going to be a candidate for different options than a woman who may want to conceive in 10 years or never. Some of those longer acting options are some of the most effective options as well, because there are things that we as providers do, and then patients don't have to do anything. That would include reversible methods such as the arm implant or an intrauterine device, as well as permanent options such as a tubal ligation surgery. Shorter acting methods are also effective, but require more work on the part of the patient. So that would include things like the birth control pill, the patch, the vaginal ring, as well as the depot injection shot. Some of the less effective methods would include barrier methods and spermicides, but it is important to note that condoms are essential for protecting from sexually transmitted infections. The most effective methods are going to be those longer acting methods, again, because they're options that we as the providers place, and then the patients don't have to do anything for maintenance. The options that require more work on the part of the patient do have some benefits, but tend to be less effective because we're all human and there's a very good chance of missing a pill or a dose of your medication. Another way to categorize birth control options is by those that are non-hormonal, those that contain progesterone only, or those that contain a combination of estrogen and progesterone. It is worth noting that the intrauterine device that is hormonal only works locally inside the uterus and does not affect the hormones throughout the whole body. Factors that we take into account when choosing a birth control method include a woman's medical history. Some birth control methods are not safe with certain health conditions. Another factor we take into account is the impact that a birth control will have on a woman's periods. We want to know if a woman prefers to have regular, predictable periods, is okay with irregular light periods, or prefers no periods at all. There are some methods we can start the same day and others that require you to be at a certain point in your cycle, but don't delay in putting off something as important as your reproductive health. Because we know that 85% of couples who don't use birth control will become pregnant in a year, if you're not looking to become pregnant, schedule an appointment to talk about birth control with your provider. We want to know what you've tried in the past, how it worked, and find the right fit for you now.